San Diego 6 News in the morning. Your station for balanced news.
It has been called the #1 killer in women. This morning we're talking about heart disease and the trifecta attached to it. We welcome Dr. Michael Mikowski from Alvarado Hospital with more. You've been studying this topic for a very long time. Good morning. Thank you so much for being here with us.
Thank you.
So an expert in the field. We're talking about that trifecta that I just brought up. What is that trifecta? What do we have to be aware of when it comes to heart disease?
The trifecta we're talking about today is high cholesterol, diabetes, and high blood pressure, each of which are individually risk factors, but when added onto each other, become multiplicative.
Okay, we hear a lot about diabetes, but high cholesterol, it's something that maybe you don't hear as much about, but when you go to talk to your individual doctor, all of a sudden there can be a concern about different things. When do you start screening? When do you start asking your doctor about your cholesterol?
Typically in the mid-30s, but if you have certain risk factors that would increase your predisposition to heart disease, you might check sooner, such as if you're a smoker, or a family history of early heart disease, or high blood pressure.
Now, if you do have a family history, is it weird to go into your doctor if you're 21, 22 years old and say, can you check this for me?
Not at all. I had two 19-year-olds with heart attacks.
Oh my goodness.
Yeah.
Wow.
Both of them had extremely high cholesterol. When you have a family history of heart disease, most often it's because there's a high cholesterol gene that you've inherited. Okay,
now high blood pressure. What's the difference between high cholesterol and high blood pressure? A lot of people don't know the difference.
High cholesterol, well, cholesterol is an element in your blood that circulates and can be deposited into the wall of the artery if the concentration is too high. Blood pressure, as you've probably had done yourself,
right.
Put the cuff around the arm and blow it up, and you actually measure the pressure of the pulse inside your arterial system.
Now we have a graph right now, number of risk factors present, people with heart disease. That's pretty alarming. High blood pressure, I mean, these are all, they all contribute, and they can contribute equally.
The interesting thing about that graphic is it shows that although having more risk factors is certainly more dangerous, about 50% of people with a heart attack have either no risk factors or just one risk factor. So many of these things are silent. You can't really detect them on your own without a little bit of help.
So how often do we talk to our doctor about this? I mean, maybe we go in and he doesn't see anything, she doesn't see anything, but how often should you have this stuff checked out?
I'd say it would be dependent on your personal risk. For instance, if you've had a reading on your blood pressure in the past that was what someone might call borderline, well, you're at a much higher risk for developing full-blown high blood pressure in the future, so that might be a big red flag.
Okay, now we talk so much about eating healthy. Eating healthy, you know, fruits, veggies, that all can be common sense. Exercising, though, we were talking about this during the commercial break. As a doctor, when we say, you know, the average amount of exercise a day, what is that to you guys? What do you recommend?
I usually tell people at least 30 minutes. If you can do more, that's great. I've got people that walk 4 hours a day. But speaking of walking, it's been shown to be just as beneficial for heart health as high-intensity running.
So really all you got to do is walk the dog or do something like that, and you're getting just as much good nutrition, you could say, for your heart, right?
Right. A little bit of sweat is certainly good, but if it's unpleasant, you're not going to want to do it. So you find something you like and that's reasonable.
All right. Well, doctor, thank you so much. Good advice on this trifecta. Some good stuff for our San Diego 6 viewers to look out for. Thanks so much for coming in. Of course, for more information, just go to our website, san diego6.com, and click on Hot Topics.